And our last program before a break is Genesis, Healthy Young Families of Boulder County, Colorado. And our presenters are Phoebe Norton, the Executive Director of the Mental Health Center of Boulder County, and Charles Stout, the Executive Director of the Boulder County Health Department. Welcome.
Thank you. Good afternoon. For the past 5 years, Phoebe and I have worked in partnership with a number of our colleagues throughout Boulder County to implement a very exciting and a highly productive collaborative project. Phoebe, could you offer just a quick capsule of our history?
In 1989, our district attorney had $500,000 worth of drug confiscation monies. He wanted to invest in a program with lasting impact, one that would interrupt the intergenerational cycle of substance abuse in multi-problem families. He called together the heads of human service and health agencies, public schools, and law enforcement, and asked for our ideas. You might imagine the electricity as it grew in the room as we assessed our needs, debated our significant differences, and tried to think creatively. Finally, however, we decided unanimously to target pregnant teens and their infants, pregnant and parenting teens and their infants. Further, we decided to use as part of our interagency staff successful women who had been teen parents, who could act as a role model, provide support, provide parenting education and case management. We decided to call this program Genesis for Healthy Beginnings. Other guiding principles developed as we began to work.
Those operating principles were basically three. First, we decided right at the front end that we knew this program would have to be intensive, family, home, and community-based, and it would have to have sufficient resources to really get the job done. Though highly attentive to cost effectiveness, this program was not designed to be cheap. It was designed to get the job done. Second, building on our strength in Boulder County, our program was specifically designed to advance the state-of-the-art with regard to collaboration. We decided that we would use Genesis as a catalyst to firmly establish a culture of collaboration in our county. We would then use that culture to help us address a number of other deep-seated community problems. Third, we knew that we had to build a program that would last. Although we anticipated success, we also knew that the problem of teenage childbearing is persistent. We knew that long-term success would come only if we built this project into the county's infrastructure and we were able to lock in long-term persistent funding to deal with this persistent problem. We know that Genesis services are needed now. We also know they'll be needed a year from now, and we know that they'll be needed within the next decade. Phoebe, tell us what we know about the population now.
The Genesis population is pregnant and parenting teens and their infants. In Boulder County, there were approximately 200 births to teens per year at that time. During the first year of intake, we found that 60% of these teens were born to teen parents themselves. Over one-half were victims of physical and sexual abuse, had substance abuse in their families, and significantly were using alcohol and drugs at the time they became pregnant. 28% entering the project in that first year were in their second pregnancy. All of these characteristics are still true except for one very important difference.
And of course, that difference is the very last statistic. The first year, 1990, we implemented this project. 28% of the young women that came to us were having the second birth as a teen, absolutely consistent with national statistics. By now, we have reduced that statistic down to 3.8%. A monumental achievement and the one that has made this other important difference. Between 1990 and 1993, Boulder County's teen birth rate has been reduced by 28.5%. At the same time, during that same period, because of efforts throughout the rest of the state, Colorado's also reduced, but only by 7%, while ours reduced by 28%. The low birth weight rate for these teens is 3.2% compared with an 11.4% for the rest of the state. And during substance abuse during pregnancy has been reduced to nearly zero for this whole population. With regard to collaboration, we want to admit it, collaboration is hard, but it has been worth it. We now have a seamless continuum of care for all of our county's pregnant and parenting teens. Genesis is now used as a reference point for collaboration, both in Boulder County and in the rest of Colorado. And finally, Genesis is now a part of our county's infrastructure with sustainable funding.
I think the reason for that is the county commissioners realized, Chuck, how cost-effective this program is. It costs between $400 to $2,000 per year per family, depending on the level of services needed. If we do nothing, the cost to our education, health, welfare, and justice systems are often enormous. We know this program addresses important problems, it is cost-effective, and it has successful outcomes. Chuck, what's next?
What's next, Phoebe? We're going to take the acknowledgement that we've had from being able to participate in this program, and we're going to replicate this program throughout Colorado. Before coming here, we discussed this with Governor Romer. He's vitally interested in it. Mayor Webb of Denver is vitally interested. Our professional colleagues with whom we work around the state are also enthusiastic and ready to work with us. Thank you. Don't leave.
Thank you. Questions from the panel? Max Sherman.
Your very last point is one that I wanted, if you would expand on the replication part of it, because you have a very unique county and a particular mindset, and it seems to me one or two specifics about how you see that you'll do that.
You know, people think of Boulder County as being unique and maybe being a little higher income level because it's a university town and so forth. That is really not true. Our level of poverty is higher than the suburbs in the Denver metro area and much of the rest of the state. And we have, on every problem indicator, we have significant problems that are around in the average for the state, just for openers.
What will you do to replicate?
Yes.
Okay.
We have a host of things that we've already talked about and designed. Number one, because we already have the enthusiastic support of our governor and Mayor Webb in Denver, we have targeted some specific neighborhoods. We're looking at bringing together those specific people in the state who are ready to replicate Genesis and offer ourselves as co-workers with them in founding that. We know that it will look different in each county that it's implemented. We understand and appreciate that. But we are absolutely confident, and because we have been paving the way for the last 2 years, knowing that we had to move this outside of Boulder County. Our professional colleagues, the directors of public health, mental health, social services, our district attorneys in other counties are already ready to do this and work with us.
Antonia?
Two related questions. Do you have a system for managing your client information? And secondly, how far into, do you monitor the clients who have left your program to really measure progress?
Great. What we have right now is a process whereby we have a very intensive evaluation at intake, at the point of birth of the child at 6 months, and then we follow these families. We're with them intensively up until the child's 3rd birthday. One of the things that we've committed to do with a 20% portion of this award is to help endow, if you will, a long-term longitudinal study. We want to, at minimum, and we're ready to do that now by working with the university, at school age we're going to be able to monitor these kids. Remember, though, the target population here is the fetus of an unborn teen. That's where we start. We must take that teen through, or that child, through age 21 to demonstrate that we've really broken the intergenerational cycle of dependency, and that's what we need to fund this other part for. What we've already demonstrated, though, is giving us great confidence that we're going to get that outcome.
David?
How can we evaluate your success with regard to the fetuses or the young children based on the length of the program so far? And also, can you tell us what you've done to address the issues about the fathers?
Yeah. Those are two excellent questions. And in terms of how we can demonstrate the effectiveness, we have a number of outcome measures, beginning with birth weights, which are very important in terms of the future development of the child, and several others that Chuck can tell you about, as well as the fathers.
Yeah. Basically, with early access and continuing access to prenatal care, that's why we're getting the kind of birth outcomes we are, which is the best way you give a child a head start about having the opportunity to participate actively in the educational system. The nurturing education that we give these young moms to help them work also adds additional input into the...
Is there any hard data? Is there any hard evidence? That's what I'm really looking for.
Yeah, yes. Yes, we do have hard data for each of these outcome measures. We know what the birth weights are, and we know that whether or not the babies are within developmental norms. So we measure those things.
Could you give us some sense of where you were and where they are now? I mean, what's the progress? It's hard.
Well, basically, just to give you an example, the low birth weight issue in Colorado, 11.4%. Ours is like 3.4%. We've already demonstrated that we can make a major impact on that. The drug and alcohol use is through very persistent and regular screening as we walk through the prenatal process. That gives us that. With regard to the young men, that is absolutely the single most important issue. We are not having our young women get pregnant again, but we are having 3 and 4 of our young women impregnated by the same young man. The biggest deficit, and the one we acknowledged openly in this application, is that our ability to address the needs of the young men, which are really a major significant part of the problem, is the major impediment to really providing long-term success here. And that's the one that we're going after next. That's what we're going to use this collaborative effort to deal with next.
Margot, was your question already answered?
Yes, it was.
Jack, was yours?
No, do we have time?
Yes, we got what? Oh,
No.
is time over?
Better be.
Well, sorry. Thank you so much.
Thanks.
Appreciate it.